I had a patient who had POTS, but he was still sick. On further evaluation, he had Lyme disease. So let me go into this story as part of my Common Sense Lyme disease series. I'm Dr. Cameron. I base this series on my patients that I see and issues that come up in my practice. So this gentleman had been experiencing chest pain and tightness. He was young. He thought it was heart related. So he did the typical echo, stress tests, and Holter, and they were all normal. His cardiologist, though, suspected POTS. This is postural orthostatic tachycardic syndrome. It's an autonomic issue where someone can feel lightheaded, but instead of being purely cardiac, he suspected that perhaps Lyme disease was a possibility. So his cardiologist did some autonomic testing. He checked for blood pressure and pulse type of changes with positioning. He used a tilt table and, yes, confirmed POTS. But he also suspected that Lyme disease was a possibility. There was no tick, no rash. The Lyme test was positive, but it said past Lyme disease. Now, when you have a past Lyme disease, you're talking about an IgM pattern. Now, Lyme disease does not resolve just because you get an IgM pattern. And so he was started on treatment. Part of the reason that he was treated was that he had other issues, like unrelenting malaise, brain fog, his sleep was a problem, and he had muscle aches, pains, temperature sensitivity. Now, temperature sensitivity is an autonomic issue, but so is POTS. He started treatment, and that's where his symptoms started improving. Not just the cardiac symptoms, not just the POTS. His brain fog lifted, his energy improved, chest tightness that had originally brought him to the cardiologist improved. So the bigger picture is that Lyme tests aren't always as helpful as we'd like. It was fortunate the cardiologist at least suspected that pressure was from POTS. Now, I find that POTS is pretty common in Lyme. That's because Lyme disease is an autonomic issue, or at least commonly an autonomic issue. In children, like adolescents, young adults, POTS is extra troublesome. POTS can be bad enough that they can't participate in sports. It may even have difficulty attending school, and it's harder to treat. So I find that the combination of working with a cardiologist on POTS, perhaps taking cardiac medicine for POTS, and treatment for Lyme is helpful to my patients. So I wanted to present this case so we can discuss autonomic issues and POTS. Appreciate you joining me. Have a good day.